Hello, my name is Kim Miller. I'm a lead profitability coach with Inspired Hygiene, a registered dental hygienist. I'm a national author and speaker and a columnist for RDH Magazine. I'm also a 3-time graduate of the Bale-Donine Method Preceptorship course. And if you've not taken the Bale-Donine Method course, let me strongly suggest that you do that. It will not only change the way that you treat periodontal disease, it will change the way that you speak to your patients about the relationship between diabetes, heart attack, and stroke. Here's the Bale-Donine website, www.baledonine.com. You can certainly take a look at their website and learn more about their preceptorship program. Not only is this going to change the way you interact with your patients, but it's going to be life-changing for yourself and potentially for your family members. So you've heard me talk about heart attack and stroke and the relationship of some of the periodontal pathogens to heart disease. Today what I want to do is talk with you about diabetes. According to the Mayo Clinic, there are 7 million undiagnosed cases of diabetes. 7 million, that's a lot. As a dental hygienist, as a dental healthcare professional, there are a couple of ways that I can impact my patients' lives, especially when it comes to diabetes. A couple of the things that I can do is look at their body type. A patient that has an apple-shaped body with very slim legs, a woman who has a waist size of 30 or greater, men a waist size of 35 or greater, typically fall in the category of abdominal obesity. And very often those people have diabetes that's been undiagnosed. A diabetic patient that's undiagnosed also might have a lot of periodontal disease activity that you really can't explain. Their home care looks pretty good, they're doing a relatively good job with removing the biofilm at home, but yet you keep seeing their periodontal disease progress, and maybe they've got a couple of other factors like abdominal obesity or perhaps even high blood pressure. Asking every single patient that we get in our dental hygiene or dental chair what their HbA1c is also very important. HbA1c is a blood test that is a reflection of the 3 previous months of diet. It has to do with how much sugar is attaching itself to the red blood cells. So think this through with me for just a minute. If the patient's blood sugar is high, it means there's too much sugar floating around in their blood, which also means that their blood serum is going to have sugar in it. Well, what is gingival crevicular fluid? It's not saliva. It comes from the blood serum. So if the blood sugar is high, the blood serum is going to have a lot of sugar in it, which is what the gingival crevicular fluid is, and it's going to feed the periodontal pathogens something that's easily digestible for them. Simple carbohydrates, sugar, it's the pathogen's best friend. So when we have a patient that has their blood sugar out of control and really active periodontal disease, we can be speaking to the patient about their diet from the standpoint of what happens in their saliva and their blood sugar, how it's impacting their periodontal pathogens. So I hope this shifts the way you're looking at diabetes. Take a close look at your patient's body type. Ask them some questions about glucose tolerance, or maybe they're insulin resistant. They may be an undiagnosed. They may fall in this 7 million that are undiagnosed diabetics.